Okay, somebody thought of one. Very good.
I'm Dr. German. I'm from San Francisco. I have a question for Phil Micans. Have you correlate the arterial wave velocity with stress treadmill test?
It's early days at the moment. I think although the technology for measurement has been around a while, we found very few experiments, if you will, of trying before and afters with various things. So the short answer for you is there may be, but I don't know of them. But it's not, we did look in the literature for various things, but there hasn't been a great deal of it. Although there's been a lot of proof of the technology and how the technology measures, there is very little sort of actual experimentation with what actually improves. So even exercise, diet change, all that sort of thing. So I think it's early days, but what I really wanted to show was we've done some, and I think it's exciting that we can show that we can get significant decreases very quickly. I'm no doubt, I mean, one would imagine that reducing stress, reducing cortisol, and other factors like that would have an impact on arterial stiffness. It has yet to be proven, but one imagines it would do.
Just as a backup to that question, Phil, do you find that the various responses that you've seen would be synergistic or additive, so that you may want to use the carnosine, resveratrol, arginine? Are you thinking about combining them in the average patient, or what are you finding?
Thank you, Gary. That's a very good question. I think there's no doubt that when one acts holistically, and if one, you had the patient I showed you at the end who after a year, who did all sorts of things, you know, they changed their diet, they reduced their stress levels, they did more exercise, you know, they took supplementation, they did a lot of things. And of course he had a big result, a big improvement for his vascular condition. But I think you're absolutely right, Gary, and as a pharmacologist, yes, I think there's a lot of synergy, and we've actually been doing some experimentation with a combination of carnosine, resveratrol, trace minerals, pyridoxamine, which is the rare form of B6, and it's worked very well. We haven't actually included aminoguanidine in some of the other supplements because some countries consider aminoguanidine to be a drug. But as we've seen from the Russian studies, aminoguanidine does seem to be the most potent anti-glycator we have at the moment. But yes, I think combining things is generally a good idea.
Well, we have to have tests that relate to what the patient is concerned about. And if the patient is only thinking about stroke risk, they may not put one and one together. And I just want to have the concept in everybody's mind that the test that you're doing will relate very tightly to what you will see on thermography and segmental blood pressure reading, because when I formed ACAM, and before we treated the 10 million patients that have been safely treated with the IV chelation that I wrote the protocol for, we had to come up with tests. And we'd made most patients, you either had to have stress cardiology or a Holter monitor or a thermograph or segmental blood pressure. That's simple. If you have half as much pressure in your ankle as you've got in your arm, you're going to lose your leg. I mean, this isn't complicated. And what you have to have is data that can help people stay with programs, because I like the way you presented it. You said you don't promise anybody that taking this for a month is going to change the outcome. If we want to be as vigorous in the 90s as Linus Pauling was, and there's no point in living to 90s if we're not vigorous in all capacities, I think we need to do it. But it always takes a test the patient relates to. And I'm only saying that all because some patients come to you and they're only worried because everybody in their family has cancer. So then you got to be able to switch over and do some tumor markers. There's panels, which I discussed 2 days ago, which Greg Stavish has nicely recorded. So those of you who were not here for the bioidentical workshop that we did here on Wednesday, would be able to have an 8-hour presentation on these things. Have we got somebody else worked up with a question out here? Because we can't let Sandra Rose Michael sit here without questions. Somebody's got to have back there.
Thank you. My name is Minna Rajpuri. I'm a medical doctor, an osteopath and naturopath. Now, this is something that's been a personal dilemma. So it's initially to Dr. Tiller. In osteopathic school, in medical, naturopathic school, we learned about the toxins, and we, learned that you have to detox, and, it really applies to all three speakers. And then, as a naive medical student, I went on to medical school and tried to explain this to my professor of medicine. I wonder, is there an international definition and classification system for toxins that we all talk about? Thank you.
I think it's hot, Dr. Tyne. Just try it.
You're asking me if there's...
An international definition system for these toxins, because we know that they're there, because if they were not there, we wouldn't have disease, as one would say. So the first question is there an international definition system? The second question is, if there is a definition system, is there a classification system for these toxins?
We have no study at this time. We have equipment at Loma Linda Medical School, Bastyr University, and National College, and hopefully we're going to get a study completed pretty soon so that we can have prove this. We are very restricted in anything that we can advertise or say about the colon hydrotherapy and the benefits of it, because the FDA says without a study you can't say anything. So we can't tell you all the things that it's good for, but I've seen it clear up arthritis. I've seen it clear up acne. I've seen so many things. Asthma, I've seen asthma totally cleared up by just doing colon therapy. But I don't know of any international standards. We do have an international association that all the colon therapists around the world belong to. That's as far as we've got so far. Thank you.
So just as a comeback to that, does one see maybe next year's conference having a mini workshop session whereby people can come together and define what is a toxin and hopefully try to classify it accordingly?
Oh, that would be wonderful.
Thank you. Thank you.
Well, of course, there are many different toxins, and that's a very broad spectrum. But if you want to, particularly if you want to know how to chelate, there are a number of useful sites. And I know Gary's very shy and bashful, so I'll say it for him. But if you go to gordonresearch.com, it is a very useful site. But I'm sure Gary might be able to tell us more about if there are actually any institutes that are specializing in that area.
Well, the American Academy of Environmental Medicine were the first ones to jump on to this whole field, and Dr. Monroe was one of the early people to jump and get involved with them. And there are excellent books out. I mean, Detox or Die. There are many books out today that try to identify you. There's so many thousands. We have 80,000 chemicals that are getting into our bodies that we know so little about. I simply did one thing. I read National Geographic October '06 issue, and it was so impressive that if you go to gordonresearch.com and you put in the search word the National Geographic, you will have an article that will make you an expert overnight, because they took Dr. David Ewan Duncan of Harvard Medical School, who's written an excellent book on genetics. He's a world expert, and they made him a guinea pig. And they said, Dr. Duncan, you're a bright medical doctor in a big famous university. How toxic are you? Well, if you want to find out, you either spend $4,900 with Mount Sinai School of Medicine, and we test 220 chemicals, but they went a little bit beyond that. They tested him for 330 chemicals, but that was a little more expensive. That was $13,000. But I'm just telling you that go to my website, Gordon Research, put in the word National Geographic, and the article will be there with every reference and every picture, including 2 pictures of lead poisoning, a lead-poisoned child, and they have the complete scorecard. That doctor flies like I do, so what is he poisoned with the most? What do you think if you live on airplanes? We had to fix the airplanes so that you won't burn up in case a terrorist comes or something, so we have a lot of flame retardant. So flame retardant is loaded in the doctor. Now, if you just think about it, across the board, the average person in this room has 10,000 times more phthalates, 10,000 times, than you had 10 years ago. The average person on planet has got 1,000 times more lead, so this isn't very complicated. And if you just take that National Geographic and download the pictures, they're in color, and use them to show your patients where the toxins are coming from. If you don't like them, go to EPA and put in their website, or FDA. They have all the pictures to show people where the lead comes from in your home. Until 10 years ago, the tubs in our country, the enamel was lead. We have a simple stick you can buy, a lead check, and you can touch everything in the house and find out how much lead is coming into you. I mean, it's part of good medicine is not just for me to chelate the whole world, which I'm now at the point that I'm doing,